As said before, my presentation is about the employment of photobiomodulation on the inflammatory cytokines in the oral cavity, and how does it work on the oral microbiome. This is a pilot study, since we collect a restricted number of patients. This is the place where I work. This is the here on the upper side of the screen. You can see the hospital, the city hospital in Trieste, where I work. And here below, the two centers that collaborate with us and collaborated for the publication of this preliminary work. So on the right side, the International Center for Genetic and Engineering and Biotechnology, the ICGB, and the pediatric hospital, where there are laboratories dedicated to the analysis of the microbiome and the cytokines. So this is the paper we published, and but I would like to start, because to fully understand what we describe in our publication, we need to start from a clinical issue that me and my team have in our daily clinical practice. We really often deal with a patient like Mr. Giuseppe. Mr. Giuseppe is an oncological patient, a head and neck cancer patient, which was undergoing chemo and radiotherapy for his malignant tumor. And Mr. Giuseppe, like many other our patients, developed a very severe oral mucositis during his anti-cancer treatment. As you can see, the right side of his tongue, all the lips, both superior and inferior lips, were affected by ulcers, erythema, and of course, Mr. Giuseppe suffered from a very severe pain in his mouth. So mucositis generally is an inflammation of the mucosa that can affect all the alimentary tract. So from the oral mucosa to the gastrointestinal mucosa to the anus. What we deal in our unit, of course, is oral mucositis. Oral mucositis is a toxicity related to anti-cancer treatment, which can prevent patient from eating, swallowing, chewing, speaking. So it is a really debilitating side effect related to anti-cancer therapies. And oral mucositis can lead to other infections, and really important, in many cases, it could lead to the suspension or interruption of anti-cancer treatment with a subsequent negative impact on the overall therapy. Oral mucositis had been described by Dr. Sonis in this really important publication, The Pathobiology of Mucositis, published in 2004. As we all know, oral mucositis could be related both to radio or chemotherapy, and it follows 5 different phases. The first phase, which is called initiation, we have a direct damage to the DNA related to chemo or radiotherapy. Following the first phase, we have an upregulation and the generation of different signals mediated by different cytokines. And this is really important, because then we analyze, and you will see the results related to the regulation of cytokines following the treatment of oral mucositis that we perform in our patient. Afterwards, we have an amplification of this signal with the progression of the damage to the oral mucosa. On phase 4, there's an ulceration, so the formation of fibrin and eventually the superinfection of the affected sites. Finally, we move to phase 5, where the epithelium starts healing with migration, differentiation, and proliferation of different cell lines, which lead to the restitutio ad integrum of our tissue. The impact of oral mucositis is really important because the incidence of this side effect related to anti-cancer therapies is really high. It is different from patients which are subdued to radiotherapy, only radiotherapy, only chemotherapy, combined treatment, so radio and chemotherapy, or hematopoietic stem cell transplantation. The incidence of oral mucositis in head and neck patient undergoing radiotherapy ranges between 15 and 45% according to the number of gray and the number of radiotherapy sessions. Once the patient develops oral mucositis, really often we need to suspend the therapy with a negative impact on patient survival. The costs related to the treatment of patients with oral mucositis are really high and increases in patients undergoing transplant or combined therapies. Some years ago, more or less 10 years ago, in my experience and in the unit where I work, we start treating oral mucositis with photobiomodulation. So the employment of a light source, and in particular in my case, the employment of a diode laser. Why? So with this slide, I want to explain you the rationale to employ the photobiomodulation in the treatment of oral mucositis. So as I described before, patients with oral mucositis suffer from severe pain. Photobiomodulation has an analgesic effect, has also an anti-inflammatory effect and improves vascular activity, so to manage the inflammatory infiltrate and the damage to the vessels. We have atrophy and ulceration, so the presence of ulcers, erythema, and lesions in the oral cavity. And photobiomodulation is effective in speeding up all the metabolic processes and reducing the healing time of those lesions. It is also able to manage local infections since it has been proven its antimicrobial effect and immunomodulatory effect. Of course, in a 20-minute presentation, I will focus my attention on the paper where we analyze the anti-inflammatory effect and immune modulatory effect of this treatment, and partially on the antimicrobial effect, talking about oral microbiome. This is our experience. So photobiomodulation is effective on oral mucositis, both on adults, but even on pediatric population. This is an Italian multi-center randomized trial. This is the protocol we employ. So 4 days, 4 consecutive days of laser treatment, followed by 3 follow-up recalls once a week for 3 weeks. And the protocol is based on the use of a diode laser with multiple wavelength, radiance fluence, and time exposure time are here reported, and the light is emitted in continuous way. All sites, so all treated sites, since we divide the oral cavity in 9 different areas, benefits from the employment of photobiomodulation in the regression of both ulcerations and erythema. So what did we perform? We recruited patients aged between 60 and 80 years with head and neck cancer undergoing radio and chemotherapy with moderate or severe oral mucositis, so grade 2 or 3, according to the common toxicity criteria scale. And patients were asked to be available for 5 consecutive days because we perform for 4 consecutive days the photobiomodulation therapy, and the day next, so on day 5, we perform the last sample collection. I will explain you in a while. Since we all know that inflammation and cytokines flows really fast, so to measure cytokines 1 week after the photobiomodulation therapy would have been too longer time. This is the scheme, the clinical protocol that we applied. So we collected with an oral swab the sites, 1 ulcerated and 1 healthy area before performing the treatment, and after the treatment every day for 4 consecutive days. Same was performed on the 5th day, where we did not perform any treatment, so just 1 collection in 1 ulcerated and 1 healthy area. What did we perform? We perform an analysis, the sequencing of different cytokines was performed by an automatic machine. Here a clinical example of a patient affected by mucositis. So this was the day 1 and day 5, last day of treatment. As you can see, the reduction of erythema and ulcers is really good. And the concentration, so of 38 secreted proteins, a comprehensive panel of pro and anti-inflammatory was analyzed every day for 5 consecutive days. Here, for your information, I reported all the cytokines and chemokines analyzed. Cytokines were divided into pro-inflammatory and anti-inflammatory cytokines because we were interested in how they changed over time. Really important, we focused our attention on interleukin 1 alpha, which is responsible and one of the first cytokines which initiates the pathobiology of oral mucositis, And here you can see that comparing before and immediately after the treatment, its expression decreased immediately. So in the in really few minutes timing. Same consideration for interleukin 1b, which has the same role, so a reduction, net reduction in ulcerated area, and an increase in on what concerns interferon gamma, which is an important target in the immune response. And we have an overall improvement all along the protocol, the clinical protocol. Tumor necrosis factor, which decreases the severity of oral mucositis, show a decrease in its expression over time. So, two clinical trials only assessed the effect of photobiomodulation on inflammatory mediators in the oral cavity. What we found was a really early anti-inflammatory effect in areas which were ulcerated, but a later anti-inflammatory effect in apparently healthy areas. So pro-inflammatory cytokines were increased during the sessions, and then they came back to the initial level at the end of the treatment, so along the mucosal healing. Just two slides showing you the how oral microbiome was affected by photobiomodulation. So it was really impressive the decrease in the amount of pathogens comparing before and after the photobiomodulation treatment. So Haemophilus, Neisseria, and Prevotella decreased, while an increase was observed in Streptococcus particularly, so commensal bacteria. There was a non-responder patient, so one patient where oral mucositis did not improve after photobiomodulation, and we were really interested in how the oral microbiome could influence the response to our treatment. In this patient, commensal bacteria were absent at the end of photobiomodulation, so the opposite of what happened in other patients, and the oral cavity was colonized only by pathogens. So this could be the difference between response and not response to the treatment. Of course, this is an hypothesis, but is a nice observation that came from the study. So as take-home messages, what I can tell you is the effective in the employment of photobiomodulation to manage oral mucositis. It is able to speed up the healing of such lesions in the oral cavity. It is nowadays included in several international guidelines, both for adults and pediatric patients. And it is able to exert a really anti-inflammatory effect in ulcerated areas in the first phase, and a later anti-inflammatory effect in healthy areas. The impact in our patient and the satisfaction in our patient in pain reduction and in wound healing is really, really high. It is a really easy device to employ. However, we need longitudinal and long-term studies to analyze possible late effect, since the technology is quite young. So I thank you for your kind attention. This is my email. If you have any question, I'm happy to answer you. Should you have any future question, I'm available through my email address.